Today we talk about why you can ask 3 people at your fertility clinic the same question and somehow get 3 different answers. I'm Dr. Mark Amols, and this is Taco Bout Fertility Tuesday. So why is it that you can ask 3 different people at your fertility clinic the same question and somehow get 3 different answers? Does that mean your clinic has terrible communication? Maybe, but sometimes the problem isn't communication at all. It's that you're asking people with very different jobs, different training, and different information a question that may not belong to all of them. So today, we're going behind the scenes of the fertility clinic, who does what, who should answer which questions, and how knowing how the system works can make fertility treatment a whole lot less confusing. One of the things I notice online is complaints about fertility clinics is the communication. You'll see it online. It'll say, the communication at this clinic is terrible. Or, I talked to the medical assistant and she told me one thing. Then the nurse told me something different. Then I talked to the doctor and he told me something completely different. And from the patient's perspective, I understand why that's frustrating. You start thinking, does anybody in this place actually know what's going on? But there's something about fertility clinics that I don't think we do a very good job explaining to patients. A fertility clinic isn't one person. It isn't one giant brain where everybody has exactly the same knowledge and exactly the same information. It's a team. And the people on that team have very different education, different experiences, different responsibilities, and importantly, sometimes access to different information. So today, I want to give you a little behind the scenes tour of how a fertility clinic works. Because once you understand who does what their knowledge comes from, and what kind of questions they're best equipped to answer, I think a lot of the confusion starts to make more sense. And I want to make one thing clear right from the beginning. Sometimes a clinic really does have bad communication. We're not going to make excuses for that. The point of this episode is to help you distinguish between bad communication and the normal complexities of having a team of different people taking care of you. Let's start with a very common situation. You call the clinic and ask somebody a question. Let's say you ask, am I going to trigger tonight? The medical assistant says, it looks like you probably will. Later, you talk to the nurse and she says, we're waiting for your estradiol before we decide. Then later, that afternoon, the physician reviews everything and says, actually, we're going to stimulate you one more day. And now you're thinking, what the heck? 3 people just told me 3 different things. But did they? The medical assistant may have been answering based on what usually happens when follicles reach a certain size. The nurse may know that the physician is waiting for another piece of information. And the physician may be looking at your ultrasound, estradiol, follicle distribution, previous response, expected maturity, and the overall treatment strategy. Those aren't necessarily 3 contradictory answers. They're 3 answers coming from 3 different levels of information and interpretation. And that's the first thing I want you to understand. The person answering your question matters. And I think there's another concept here that's really important. There are different ways we learn things in medicine. One is repetition. If you work in a fertility clinic for 10 years, you're going to hear the same questions thousands of times. You learn, when this happens, we usually do this. And that experience can be incredibly valuable. But there's another type of knowledge, and that's foundational knowledge. That's understanding the physiology, the pharmacology, pathology, evidence and reasoning underneath the answer. And there's an important difference between I know what usually happens and I understand why it happens and I can determine whether your situation is different. Neither one makes someone more valuable or less valuable. They're simply different kinds of experience. In fact, the strongest clinical judgment comes from combining the two, foundation plus experience. And here's something patients may find surprising. Sometimes the person who sounds the most confident doesn't necessarily have the deepest understanding of the question. If you've heard something repeated 500 times, you might confidently say, yep, That's what we do. Then you ask the physician says, well, it depends. And you think, wait a minute. The other person knew the answer immediately. Why didn't the doctor know? Because it depends is often the beginning of an individualized medical treatment. So let's go through some of the people you're likely to encounter in the fertility clinic. And before I do, one big disclaimer. Every fertility clinic is structured differently. These are generalizations, not rules. One of the first people that you'll encounter is the front desk. Your front desk staff generally knows scheduling, appointments, paperwork, records, and how the office operates. And because they answer questions all day long, they may know a surprising amount about fertility treatments. But much of that medical knowledge may come from hearing the same conversations repeatedly. So, what time is my appointment? Great front desk question. Should I increase my FSH because I only have 4 follicles growing? Not really a front desk question. What about billing and authorizations? They got all the billing and financial staff. They're the experts on pricing, packages, authorization, and often insurances. So the question, did my insurance authorize my IVF cycle? Perfect. But does my insurance cover PGTA? Great question for them. But do I need PGTA? Well, that's no longer a billing question. Even though the words are almost identical, you've crossed from a financial question into a medical decision. It doesn't mean they may not know the answer. Again, from experience, they may. We have some billers who could probably answer more questions than medical assistants. But again, it's based off of experience, not based off of foundation. And that leads into medical assistants, because many of them develop tremendous practical clinical knowledge. They work with patients every day. They see the workflow. They hear the physicians, the nurses. They may even teach them things. They may communicate medication instructions and know exactly how the clinic normally handles common situations. But much of that knowledge may be experience and repetition rather than the deeper foundational medical training needed to interpret unusual situations. So an MA may be excellent at telling you, here's what the doctor instructed you to take tonight. That's different from, given my response, should the doctor increase my medication tonight? One is communicating the plan, the other is determining the plan. And those are very different questions. The next group is going to be nurses. Now, at our clinic, we separate nurses into FET and to IVF. And this adds more complexity because now you're asking an IVF nurse an FET question they don't know. Not because they can't understand it, not because they're not smart enough, but because we have chosen to make this structure at our clinic. But nurses bring something different than medical assistants. They bring formal medical education together with clinical experience. They're often a fantastic resource for medication education, side effects, treatment instructions, and identifying when something isn't following the expected course. And they're also frequently the people who recognize, okay, this question needs to go to the NP or physician. And that's an important part of expertise too, knowing when something needs escalation. Nurse practitioners and other advanced practice providers have further medical education for evaluation and medical decision making. They have a broader medical foundation. Depending on the clinic and the situation, they may evaluate patients, interpret results, and even make treatment decisions. They also accumulate tremendous pattern recognition from this experience. And then last, there's physicians. The difference isn't simply that the doctor memorized a larger medical textbook. The major difference is the depth of foundational training, physiology, pharmacology, pathophysiology, diagnosis, evidence, risk, competing treatments. That foundation is what allows you to encounter something you haven't seen exactly before and reason your way through it. I'm able to answer questions I don't even know the answer to because I can use my foundational knowledge to answer something I haven't encountered. That's why questions like, should I cancel this cycle? Or should we change protocols? Or should I have surgery before IVF? Or should I retrieve again or transfer the embryos I already have? Need that broader clinical framework. Those aren't simply questions about what normally happens. They're questions about what should happen to you. And then we get the embryologists. They're a fascinating group because they have a lot of experience in embryology, and they may know about what happens inside an IVF laboratory almost more than anyone else in the building, even including the physicians. You ask them about fertilization, culture conditions, embryo development, ICSI, cryopreservation, or just the laboratory process in general, you're talking to the experts. But then somebody asks, my embryologist said my embryos look great. What's my chances of having a baby? Well, now we've crossed domains because embryo appearance is one piece of that answer, and they can answer that. But prognosis may require things like age, ovarian reserve, diagnosis, uterine factors, previous treatments, basically anything that is clinical information that may be useful in that answer. So being an expert in one area doesn't automatically make you the expert in every question touching that area. And then there's the office manager. If you're having repeated scheduling problems, messages aren't getting routed correctly, or there's an operational problem or something within the clinic system isn't working, the office manager may be exactly who you need. The point is, by knowing each of these roles, you can match the question to the role. Now, here's where I'm going to complicate everything I just told you. Job titles don't always tell you what somebody actually does. One clinic may have a registered nurse handling most patient communication. Another clinic may use medical assistants. And the medical assistants may work in all kinds of positions. They may work at the front desk. They may work in authorizations. They may help with billing. They may work directly with patients clinically. And someone who has spent 10 years as an MA working directly with IVF patients is going to have a very different knowledge base than someone with the same title who has spent most of their time scheduling appointments. So don't look at the badges and assume you know exactly what somebody knows. Think of someone's knowledge as coming from several places. Those are formal education, clinical experience, repetition, and the actual job they perform. That's why instead of memorizing this question goes to the MA, this one goes to the nurse, there's a better system. Figure out what type of question you're actually asking. So here's the algorithm I want you to remember. Before asking, stop and think, what kind of question is this? Is it administrative? Such as, when's my appointment? Or where do I go? Or can I get my records? Those are scheduling and front desk things. If it's financial, such as, what does this cost? Or was this authorized? Or is this included in my package? That's billing or financial. Then we move into treatment coordination. What dose was I instructed to take tonight? Or where was my prescription set? Or when am I supposed to come back? Depending on the clinic, that may be an MA, a coordinator, a nurse. And then we move into what we call interpretation. Why is my estrogen level doing this? Is this follicle growth normal? Or what does this result mean for my cycle? Now we need someone with enough clinical knowledge to interpret that information. And finally, we reach decision making. Should we change my dose? Should we cancel? Should we do another retrieval? Or should I transfer one of my embryos or two? We're not asking for information anymore. We're asking for individualized medical judgment. And here's probably the simplest rule for this entire podcast. The more personalized the question becomes, the more important the underlying medical foundation becomes. Now let's tackle another huge source of frustration. But 2 days ago, they told me something completely different. Okay. The first question I would ask is, what changed? Because fertility treatment is incredibly dynamic. Follicles grow, hormones change, embryos develop or don't develop. Sometimes genetic results come back or symptoms appear. The basic thing is new information arrives constantly. So imagine on Monday you're told, well, based on what we're seeing, you're probably triggering on Wednesday. Then Tuesday ultrasound comes around and your follicles haven't grown the way they expected. Now we're triggering Thursday. Was Monday information wrong? No. It was correct based on the information available on Monday. Medicine isn't a weather forecast carved into stone. It's a decision that's continuously updated as new information arrives. And there's another layer to this. The medical assistants you talk to on Monday may not yet know about the conversation the physician had Tuesday afternoon. Maybe a new lab came in. Maybe the embryologist called. Maybe the physician reviewed something and changed the plan. The person you're speaking to may be giving you the most accurate answer they have based on the information they currently are privy to. So instead of immediately saying, why is everybody telling me something different? Try asking, did something change since the last time we talked? That one question can clear up an enormous amount of confusion. Here's another one. Sometimes I get, why do people keep asking me the same question? Don't they write anything down? Well, sometimes that's fair criticism, but sometimes we're doing it intentionally. What's your name and date of birth? What medication did you take? What dose? What time did you trigger? Or the question, do you have any allergies? You may have answered these questions multiple times. Fertility treatment involves powerful medications, anesthesia, procedures, eggs, sperm, embryos, and treatments where timing can literally matter by hours. Redundancy is often a safety feature. It's the same reason the airline pilot goes through the checklist even though you've been on an airplane 5,000 times. Now, if you called 6 times about the same issue and nobody documented anything, and you have to start from scratch every time, that's a communication problem. But repeated verification isn't necessarily poor communication. Sometimes it's exactly what a safe medical system should be doing. Now, I want to get into something a little more subtle. You'll sometimes hear someone say, my clinic's communication is amazing. Everybody always tells me exactly the same thing. And that may absolutely be because they have fantastic communication. But there's another possibility. Everybody may be telling you the same thing because everybody gets the same thing. Standardization makes communication pretty easy. If every patient follows essentially the same pathway, there are fewer decision points and fewer opportunities for answers to change. Customization creates complexity. I once worked at a clinic where every single patient was brought back on cycle day 12 for an ultrasound when they did IUI. Everyone got the same dosage, exactly the same. This made things very easy. If someone called and said, well, what day am I supposed to come in for the ultrasound? I go, oh, day 12. Now, I'm not saying that's wrong or right. What I'm saying is that when there are more moving pieces, it becomes a little bit more complex, trying to keep everyone on the same page. That doesn't excuse poor communication. Actually, I would argue the opposite. The more individualized your treatment becomes, the greater the clinic's responsibility to explain what's changing and why. So I don't think the choice should be good communication or individualized medicine. A good clinic should strive to do both, customization and communication. So in the end, what do you actually do with all this? Well, first, identify what kind of questions you're asking. Second, if you're unsure, simply ask, who's the best person on the team to answer this question? There's nothing wrong with that. And if you think you've reached the limit of someone's knowledge, you don't have to say you don't know what you're talking about. Try, I think I'm asking more of a medical decision question. Is that something I should discuss with a nurse practitioner or the physician? If something changed, then ask, was there new information that caused the plan to change? And here's another incredibly useful habit. Repeat important instructions back. So for example, you would say, okay, just to be clear, tonight I'm taking 225 units. I'm coming back tomorrow morning, and I'm not taking the trigger until somebody contacts me, correct? That takes about 10 seconds, and it can prevent a tremendous amount of confusion. Being an advocate for yourself doesn't mean your clinic is bad. Being an advocate means you are invested, and there is nothing wrong investing in yourself. Now, after everything I just said, I don't want you finishing this episode thinking, apparently anytime my clinic screws something up, I'm supposed to assume it's complicated medicine. Not at all. Sometimes communication is just bad. If you're receiving contradictory medication instructions and nobody can explain why, or if important messages are not being answered repeatedly, or if no one on the team is responsible for a decision, or if your results aren't being reviewed, or if you have a very urgent medical question and can't find someone who's qualified to answer it, those are legitimate concerns. But there's a difference between the answer changed because the information changed and nobody knows what anybody else told me. Those are not the same, and hopefully this episode, you'll be better equipped to recognize the difference. I'm not going to pretend like our clinic hasn't been told that we have bad communication. Matter of fact, every change we make is based off of some type of feedback. And that's one thing I would always tell you. Give your clinic feedback. They can't fix things that they don't know. So here's what I want you to take away from today's episode. A fertility clinic is a team. It's made up of a front desk, billing staff, medical assistants, nurses, nurse practitioners, physician assistants, embryologists, and office managers, and all of them do not have the same job. They don't even have the same education, and they don't have the same experiences. and they don't always have the same information at exactly the same moment. And that's okay. The goal shouldn't be for every person in the building to know everything about your treatment. The goal should be for the clinic to have a system that gets the right question to the right person with the right information. And as a patient, you can help yourself tremendously by recommending what kind of question you're actually asking. Is this administrative? Is it a financial question? Is it an instruction question or interpretation question? Or am I asking someone to make an individualized medical decision? Because the more individualized your question becomes, the more important it becomes that the answer comes from someone with the knowledge and training necessary to make that judgment. So the next time that someone at your fertility clinic tells you something different from what you heard yesterday, before assuming nobody knows what's going on, ask two simple questions. Did something change? And who is the best person to answer this question? Sometimes the answer really will be that the communication broke down, but sometimes you discover something very different. The answer changed because your care did. I can tell you myself, when I went through fertility, I didn't know this. I thought when I spoke to someone who knew what they were doing, that they knew all the answers. So I hope this episode helped you understand, so maybe you can get better communication with the staff at the clinic you're working with. There's no wrong or right. The goal was just to help you navigate the systems. As always, if you like this podcast, please give us a 5-star review on your favorite medium. Tell your friends about us, but most of all, keep coming back. I look forward to talking to you again next week on Taco Bout Fertility Tuesday.